Welcome to the Ball State Immunology Podcast. For today's episode, we will be covering type 1 diabetes. Here joining the podcast is CJ, Aiden, and Carlos. First off, an introduction to type 1 diabetes. What is it exactly? Type 1 diabetes is a potentially life-threatening autoimmune disorder, which, based on statistics found from the American Diabetes Association in 2021, 2 million Americans have type 1 diabetes. This statistic has surely increased since then. Just a quick little thing just to understand what an autoimmune disease is. Autoimmune disease is a condition in which the body's immune system mistakes its own healthy tissues as foreign and attacks them. In type 1 diabetes, the T cells in your body mistake your pancreatic beta cells as foreign and start to destroy them. This results in the pancreas not being able to make any insulin, which is important in assisting in regulating blood sugar levels and helps with turning your food into energy your body can use. What is the progression of this disease and what are the typical symptoms to look out for? Progression of the disease in the paper Diagnosis and Treatment was explained in 3 stages. Asymptomatic B cell autoimmunity, where the presence of more than or equal to 2 of these autoantibodies found, being GAD65, ZNTAA, IAA, ICA, IA-2A, and IA-2 beta. For the second stages of these autoantibodies are still there, there's also the inclusion of glycation, which occurs when high blood glucose levels in uncontrolled diabetes reacts with the proteins in the body, forming unstable compounds known as advanced glycation end products, or AGES, which shows that there's damage to the B cells, as well as it being a biomarker used in gauging aging and development or worsening of other autoimmune disease. Third stage they listed includes polyuria for diabetic ketoacidosis, where the body produces more urine than normal. Each individual can experience different lengths with these different stages, so it varies. What's it does to look out for? Feeling more thirsty than usual, urinating a lot. For children, it's commonly seen bedwetting at night, so definitely parents keep a lookout for that. Feeling more hungry than usual, losing weight without trying, feeling irritable or having other mood changes, feeling tired or weak, and experiencing blurry vision. And when feeling these symptoms, what should you do? First important thing to do is to bring this up with your or family physician, or from there they can request for you or your loved ones to undergo a glucose test. Who else should be aware or consider getting this test? The main thing is if your family has had history of diabetes, whether parent, grandparent, it is important to get ahead of this. Be sure to present your symptoms, and this can also allow for medical insurance to cover the cost of the test. What is the process of screening for diabetes? In general, you can request it from a doctor, and from there you can be sent to have a lab work done. The process consists of fasting, so not eating for about 8 to 12 hours um, before the glucose test, with only water um, being able to be consumed. This allows for them to have a base level to work with, and they'll give you an oral glucose solution and monitor the glucose spike in your blood. If the blood glucose is seen to be above a certain threshold, this can be an indicator for diabetes. A urine test can also be used to determine if there is glucose or ketones in your urine. Glucose in the urine indicates that your blood sugar is high and your kidneys have to filter out the excess glucose. When testing for ketones in your urine, It is used as an indicator to see if your body isn't using glucose for energy because of the lack of insulin and instead using fats. If your body breaks down fats too quickly, the blood becomes acidic, resulting in ketoacidosis. From then on, I'll be passing it over to CJ to get a more in-depth review.
Type 1 diabetes, first recognized in 1974 and 76 as an autoimmune response. However, Sir Harold Hemsworth differentiated between type 1 and type 2 diabetes in 1936, which then was treated with a low carbohydrate and sugar and high in fat and protein diet, as the life expectancy is 10 to 12 years less than the general population, most often seen in children and young adults, accounting for 5 to 10% of diabetes cases. The cause of type 1 diabetes is a result of genetic and environmental predisposition. Onto genetics, it increases the likelihood of type 1 diabetes. Many won't go on to have type 1 diabetes even if they have the genes. This is because of the predisposition that is needed to initiate the disease. Onto environmental, the virus presenting um, an antigen to the cells would be developing the type 1 diabetes, while diet and lifestyle don't cause type 1 diabetes at all. In the immune mechanism, type 1 diabetes is a result of the pancreatic B cells within the islets of the Langerhans undergoing an type 4 autoimmune response. Type 4 or delayed type occurs 1 to 3 days after the control after contact with the antigen, more distinguishable as cell-mediated reactions. CD4 and CD8 are initiators through cytokine secretion that activate the macrophages. Activation happens in two phases. In the sensitization phase, development of antigen and specific T cell population takes at least 7 days to generate the specific T cell population. In the effector phase, T cell activation and recruitment of macrophages and non-specific inflammatory cells occurs 24 to 72 hours after re-exposure. This leads to sustained inflammatory response characterized by tissue damage and cell infiltration at the site of antigen exposure, as well as dysregulation within the innate immune response signaling has been linked to disease progression. Now on to Aiden for more background information.
All right, just getting into some more miscellaneous topics. So, what is the difference between type 1 and type 2 diabetes? Like we already kind of discussed, type 1 diabetes is an autoimmune disorder where the body cannot produce insulin um, because of damage that's already been done by the immune system to the pancreas. Um, type 2 diabetes differs from this. On the other hand, it's not an autoimmune disease. Rather, the body um, makes less insulin or is less effective at using it um, just by something usually impacted by genetics or obesity, inactivity, or high blood pressure. And so, due to it not being an autoimmune disease, type 2 diabetes is much more preventable in comparison to type 1, where it's um, yeah, largely genetic and it's from hypersensitivity. It's this one's from largely environmental factors along with the genetics. Um, and type 1 diabetes is also considered much more severe along with this. So, what lifestyle moves can impact type 1 diabetes? Diet and exercise can all work with the insulin treatment to have a great impact. Diet can help you control your glucose levels and manage the spikes, as well as working or exercise can increase your muscle uptake of insulin, which can potentially reduce the amount of insulin that's needed. Essentially, diet and exercise can help maximize the effect of the treatments that you have. Um, it's not enough to just diet and exercise, but um, yeah, they can help you maximize the effect of the treatments you get. Alcohol, on the other hand, can have a significant effect on your blood glucose levels. especially when combined with the medications that someone may be taking that does have type 1 diabetes, and they can cause low blood sugar or hypoglycemia. Um, so while consuming alcohol, it can be done by somebody with type 1 diabetes. It just needs to be taken seriously. And it's definitely something that you need to be careful with if you are somebody that does have type 1 diabetes. So, is type 1 diabetes more common in men or women? It is seen more common in men than women, although it's definitely far from just a male only disease. We're not really sure what the reasoning is behind this. It's just presumed to be found somewhere in the subtle differences in the immune system between the genders. Yeah, just the subtle differences. And it's less than a 2-to-1 ratio between men to women. So it's there is a noticeable difference, but it's not anything enough to relate it to be just a male disease. And just getting into something in the future that could potentially have a breakthrough in how we treat this disease. CRISPR editing is seen to have um, a potential application to almost any disease or issue, just across the board in the medical field, I guess. But for immune issues like type 1 diabetes, the application seems it's almost perfect. If you could rewrite the genes in somebody that does have type 1 diabetes to produce their own insulin, um, yeah, and just somehow still be able to keep the immune system from attacking the cells in the pancreas. Type 1 diabetes would seem to be easily fixed by this. Um, if you're not sure what the CRISPR editing is or just gene editing, it's just a tool that is not yet being applied to treatments to edit genes and make just things happen that to resolve issues. But it's largely spoken of as having a vast area of use and yeah, a very high ceiling. Um, yeah, for saving lives with many issues. Um, Again, it's not being readily used right now, but it does have the potential to save a lot of lives in our own lifetime. So it's something we could see, uh, yeah, very recently. Um, so now I'm going to pass it on to Carlos.
To treat and monitor type 1 diabetes is with insulin injections. This can be taken with a syringe and needle or a pen. Injection spots would be either in the abdomen or upper arm. Some common brands are Humalog, Demelog, Lantus, Solstar, and Traceba Flex Touch. Insulin pumps, there are different types of pumps where they can be attached to the abdomen or upper arm. These devices are programmed to inject insulin into the tissue constantly. The pumps will inject at a basal rate, which is a small amount of insulin at a steady rate, and bolus doses, which are large amounts of insulin, usually taken before eating meals. One of the type of pumps are patch pumps, which are usually attached to the upper arm. How it works is that you fill the pump up with insulin, then press a button, which will have a needle stick, a cannula, which is a thin tube that ranges from 6 to 9 millimeters in length right into the arm. The pump is usually changed every 2 or 3 days or unless it runs out of insulin. This pump can be controlled with a remote or an app on the smartphone. Another type of pump is a tethered insulin pump that you first fill with insulin, then has a patch usually attached to the abdomen with the cannula, which has a length of 6 to 9 millimeters. From the small patch with the cannula is a tube with a length of 18 to 23 inches connected to the pump, which you can either clip onto the waistband or carry it in your pocket. The pump itself is where you do the programming, and the cannula and tubing needs to be changed every 2 to 3 days. The site of insertion should also move to prevent irritation to the skin. The way it works is after insulin is injected into the skin, it will gradually diffuse into the bloodstream. And the insulin works by replacing the insulin the body cannot produce itself, allowing glucose from the bloodstream to enter cells throughout the body so they can use it for energy, effectively lowering blood sugar levels. Insulin is able to be manufactured commercially by genetically manipulating them through a process called recombinant DNA DNA technology, which is altering bacteria to produce the human insulin protein. And the bacteria usually used is E. coli. For monitoring the blood sugar, blood glucose monitors are important for people with type 1 diabetes because it allows them to check themselves to see if their insulin is working and what doses are needed, or that a diet or food intake needs to be changed. Some types of monitors are continuous glucose monitors, CGM, or monitors that require test strips. Some common CGMs are Dexcom G6 and Freestyle Libre. For the Dexcom, a small sensor is inserted into the skin, either the abdominal or upper arm, near where the insulin pump is. Then a transmitter is snapped onto the sensor. The sensor will continuously measure every few minutes, sending the data to either a receiver or app on the smartphone. The transmitter battery can last up to 3 months, and the sensor can last up to 10 days. For Freestyle Libre, it works close to the Dexcom, but you need a transmitter because it is just a sensor. And for this sensor, you need a Freestyle Libre reader to tap against the sensor to read the glucose levels and and can't use an app like the Dexcom can. For test strip monitoring, some common brands are Accucheck and OneTouch. To use it, you need to buy a glucometer, which will come with a few hundred test strips and a lancet pen that comes with around 100 lancets. The test strip gets put halfway into the glucometer, and the other half sticks out in order to soak up the blood. You prick yourself in the finger with the lancet pen that stabs you with the needle really quick. Then you push out a drop of blood to touch the test strip that's in the reader. Then you receive your results and record them to compare them with your other test. People will test themselves about 2 to 6 times a day, and the glucometer usually lasts up to 2,000 tests. Patients will usually take those recorded tests to the doctors to figure out if they need a change in dose or if they're on the right path. I work at CVS, so then there's different sized lancets and test strips which correlate with the same brand needed for your Accucheck and One Touch. So usually, if we usually patients need more, and we probably run out either in the front store or back in the pharmacy, they usually have to wait for our next order or have to go to nearby CVS, but then that's just an extra travel distance and it does get annoying. So it is annoying that they are different sizes because the brands are just trying to get money for themselves. And then for immunotherapy, it's with an monoclonal antibody called teplizumab. There's an article by Emmanuel uh, in immunotary effects on pancreas. Teplizumab targets specific immune pathways in type 1 diabetes by altering the phenotype of autoreactive CD8 plus T cells. It favors effector T cell depletion while preserving regulatory T cells. The drug induces gut trophic regulatory cells, potentially influencing immune responses in the gastrointestinal tract. Trials revealed that the teplizumab's positive outcomes justifying its use, especially in individuals with specific HLA genotypes and serological markers. This immunotherapy is usually used on people who are tested for before confirming that they will have type 1 diabetes.
All right. Thank you guys all for the insights. The main thing that we can do just to improve the lives of those that are struggling with diabetes type 1 is exercise, making sure to get tested. If your family has a history of it, you should be aware of that and just take care of yourselves. All right. We'll be leaving you off and hopefully we see you guys next week. Stay healthy.